Welcome back to my channel. My name is Khadijat Adeshola, and in my channel I talk about everything related to women and midwifery. So today I'll be talking about another aspect of midwifery. So today I'll be talking about midwifery interview questions and answer. So if you are a midwife looking to get job, and if you're a midwife and you're currently applying for jobs, so these are interview questions you may be given. So if this looks like what you are interested in, kindly stick around, watch this video till the end, and don't forget to like, comment, share and subscribe to my channel. Like the third time I'm doing this type of video. So if you are currently looking for a job, or you have an interview, preparing for an interview, you can watch some of my other videos about the midwifery interview questions that you may be given. So I have some questions written in here. So some of these questions are questions that I coined myself, or questions that I have been asked previously. So it's based on my own knowledge and some personal experience as well. Okay, so one question you may be asked is, what did you know about CTG? So I have a video about CTG as well, which is like a basic. CTG is basically much, but you should be able to know about the basics. So if they ask you, what did you know about CTG, so how are you going to answer this question? So CTG is also known as cardiotocograph. It's a machine that is used to assess fetal well-being. Okay, it can be used both antenatally and in labor. Simple. So it's a machine that is used to assess and monitor fetal well-being. It can be used both antenatally and during labor. Okay, now if they give you a CTG to interpret, basically they will give you CTG just for you to, when you are interpreting a CTG, you are interpreting the overall, which is you want to know whether this CTG is normal or whether there is anything abnormal regarding the CTG. So you look at whether there is evidence of hypoxia. Is it that there is something coming up, gradually evolving hypoxia, compensating, gradually evolving decompensating, or there is acute hypoxia. So now for you in the CTG, they give you a CTG, what you should look at first is the baseline. So basically you'll be given a question, so you need to read the question to get an overall clinical picture. Was there any underlying issues, like is it labor spontaneously, is the patient, is it a labor CTG, or is it an antenatal CTG? You have to take note of that first. If it's an antenatal CTG now, so you're looking at, okay, is this CTG on criteria, right? And also you're looking at the baseline. Basically you're looking at regardless whether antenatal or labor CTG, you're looking at the baseline, you're looking at the variability, and you're looking at, is there any acceleration or is there any deceleration? Basically before you be able to assess the CTG. So the normal baseline is within 120 to 160. We can also consider 110 to 160 kind of based on. So you should look at that baseline on the CTG. Another thing is variability. So the variability is beat to beat difference. So you're looking at a CTG like that. You want the CTG to look like it's not a straight line, CTG. Then also you're looking at acceleration. Acceleration is like increase in baseline. So basically we like acceleration, it shows the baby is fine. But any deceleration, decrease in baseline up to 20 lost beats. So if now we also look at the characteristics of this deceleration. If this deceleration is recover immediately, okay, you just take note of that. But if it doesn't recover immediately, it might show an evidence of decompensating hypoxia, gradually evolving hypoxia, decompensating. Now if you have lost beats of up to 3 seconds, 3 minutes, that's like acute hypoxia. Okay, so you need to call for review. Any deceleration, any CTG that have deceleration, you must call for review, obstetric review immediately if it has deceleration, especially if it's decompensating. So in essence, if they give you a CTG to interpret, you check the baseline of that CTG, you check if the variability is good, if the deceleration, if there is deceleration or not, and if there is acceleration. So these things put together, that's what you use to say, okay, this CTG is normal. What you will do is continue monitoring. This CTG is suspicious. What you do is call for review. Then another possible question they might ask you is, why did you want to work in the NHS and what did you aim to achieve? Basically, why you want to work in the NHS is personal, and a lot of things might have motivated you to be able to say like, okay, I want to work in the NHS. So you might say for career progression, you might say that to work in an environment where you can learn with other experienced, midwives. So you want to work in an environment that foster learning and development. So but as I said earlier, it is personal. What did you aim to achieve is also personal. You may aim to to achieve to be one of the best, to learn from one of the their experience, midwives, so you'll be able to upgrade on your own personal knowledge. So now they can give you a couple of scenarios. For instance, if they say a woman come into the antenatal unit or to the clinic and the woman is having seizure, or the woman presented with raised. So now I want to talk about preeclampsia. Of course, we all know the signs and symptoms of preeclampsia, which may include raised blood pressure, blood vision, headache. So the woman comes to the clinic, you are suspecting preeclampsia, not eclampsia yet. So what you need to do is to, for instance, if the woman come in with raised blood pressure, complain of headache or blood visions, okay? So you confirm the woman's gestational age and other antenatal record, okay? Then you reassess the blood pressure. You commence blood pressure profile. So you check the blood pressure every 15 minutes. You call for immediate obstetric review as well. Then you administer, prescribe antihypertensive. Then you take some other blood samples for further investigations. So you take blood sample for full blood count, liver, kidney function tests, clotting factors, and liver, kidney function tests, and clotting factor. Then you send urine for urinalysis and PCR, and you continue monitoring her, and you also commence CTG to assess fetal well-being. So that's for if the patient presented with signs and symptoms of preeclampsia, okay? Now, if the patient presented and the patient is already convulsing, so it's an evidence, it already shows that, okay, this is an eclampsia. So this is an obstetric emergency. You put the emergency buzzer, yeah, and you declare the emergency, and you commence eclampsia protocol, basically. So the management of the eclampsia, the patient is in shock. The patient is having seizure, so you ensure the area is safe. You are not restraining her. You take anything that can make her wound herself away from the area. You take note of the time the convulsion started, the seizure started, and also the characteristics of the seizure. As soon as the seizure stops as well, so you check the patient's observation, the blood pressure. Then according to the policy, hospital policy, you commence management. You should using magnesium sulfate, okay? You also commence the continuous CTG monitoring, and you put her on magnesium sulfate regimen according to the hospital policy. So it may be the pre-shot regimen or other regimen. So according to whatever they follows in your trust, you give the loading dose, pre-shot regimen, which is a 14-gram loading dose, and 5-gram intramuscularly every 5 alternate Botox every 4 hours. But in most cases they follow the the drop, the IV, the infusion. So read about the pre-shot regimen or wherever it is in your trust, but you can actually mention in the interview that you will treat according to the hospital policy, and you use the magnesium sulfate according to the whether pre-shot regimens or what is followed in your trust, and you continue monitoring her observations and also fetal well-being. Then they could ask you some, I'm going to answer just one more question. We asked you about how do you stay updated with the latest evidence-based practices and guidelines in the midwifery. So basically, to get yourself updated, you have to read journals, midwifery journals. So you have to check on the NICE guidelines, the updated NICE guidelines, updated protocols in the management of labor. So you can check the Royal College of Midwives journals. You can check Royal College of gynecologists, yes, as well. So you need to read midwifery journals to keep yourself updated about latest midwifery practices. So that will be all for this section. So I'll see you again in my next video. So don't forget to like, comment, share, and subscribe to my channel. Thank you so much for watching.